about there is drug use, there is drug abuse,
Okay.
then there is noun drug dependence.
Okay.
We no more use the term addiction because addiction is derogatory,
Oh, wow.
and it connotes a negative perception.
Wow.
So we no more use that term.
Addiction.
So now, when you talk about drug use, we are talking about use of substance. You have a headache. You come to the doctor gives you paracetamol. That's a drug.
Yeah.
You have whatever problem it is. A doctor diagnoses you and gives you medicinal THC. That's a drug.
Okay.
That's a substance.
Yeah.
Right? Again, then we talk about drug abuse.
Okay.
That is when you use the drugs or the substances for purposes for which they have not been designed for. Particularly prescribed. And sometimes non-prescribed. And so a lady comes and says that, oh, I have not had my menses in about 2 weeks, 3 months. And then his colleague tells him that, oh, all you need to do is to mix paracetamol and Coca-Cola and tomato sauce and all of that. That's an abuse. The paracetamol is not meant for what you are using it for. You understand? And so that's the second thing. Then the third thing is now what we use, which is no more drug addiction, but drug dependence, substance dependence. Where before we say that somebody has a substance dependence, you need to meet a certain criteria. You cannot tell me, oh, I have fever, and because you have fever, it is malaria. No, it could be anything that can cause fever. And so with regards to what he was talking about, remember how he said that sometimes you go into the clubhouse, you say, I am not going to use it, and you were trying to defend them. We're like, oh, they are outliers. Yes, they are outliers. But then the more you go into the club, the more your tendency of use increases because you are exposed to it and you are seeing it. And there comes in the first one, which is the impulse, loss of impulse control, loss of impulse. So you see it, Charlie, make a triumph. For whatever reasons, a lot of people start the use of substances for various reasons. You understand? In the documentary, somebody said it was for an experimental use. Someone said so it was just out of curiosity because he saw the security man using it and decided that let me go and try it. In other cases, which is in the majority of cases, it is peer pressure, where Apostle was talking about it happening in our schools. And so we have the use of the substance, but then to make the diagnosis of substance dependence, and I would underline again the word substance, right? Because if you come to the clinic, we would first of all find out what substance you are dependent to. Somebody can be using a cocktail of substances, but may be dependent on only one of them. If you are dependent on only one of them, the effects it has on you is going to be different from if another person is dependent on a different substance. And so we talk of crack, we talk of THC, we talk of pethidine, paracetamol. You understand? This is a painkiller. Everybody knows it, everybody uses it. We talk of blue, diazepam, tramadol. You understand what I'm trying to say? So there is a whole list of substances that anybody can get dependent to. And depending on the substance that you are dependent to, that would be tailor your treatment. It is not all pain that is relieved by prescription of medications.
Okay.
Of drug. And so paracetamol is not necessarily the baseline, but we commonly prescribe it because it is readily available.
Okay.
Then again, we have ibuprofen,
Okay.
and then we have the other painkillers.
Yeah, thank you.
Yes, and so we are talking about someone who is substance dependent on a particular substance. The person has lost the control of his use. He has lost the control of his use, impaired control. I cannot determine when I want to drink alcohol. I cannot determine how much alcohol I will drink.
Okay.
I cannot determine the frequency at which I will drink the alcohol. And that's what we are talking about, impaired control. Then the second one is that the person needs to be having some form of social impairments. We are talking about substance dependence, and it is very important that we make these technical distinctions,
Okay.
right? And not overly demonize alcohol or overly demonize THC.
Marijuana. Okay, THC.
Because we can have people who are dependent on Coca-Cola. You understand what I'm trying to say? And so I'm bringing this so that we get the general perspective of what this is. So that it is not that the mere fact that KD, I like to call him KD, Kwame Dazi.
Yeah.
The mere fact that KD is using alcohol means that KD is dependent on alcohol or is addicted to alcohol. That is not the case. And so the mere fact that he was taking tequila shots in the club did not mean that whatever problems you may be having were as a result of the tequila shots that he was taking. I wanted to you understand what I'm trying to say. So social impairments, we are talking about your inability to function. And when we say your inability to function, we are talking about 4 main domains. You may have problems in functioning in your family. So, mother to child, father to child, father and mother. And so when the man who was doing the documentary came in and saw, you realize that there was a breakdown in the family.
Yeah.
The woman did not just get up and pack the things and left. There were issues that were already boiling, and it had reached its boiling point, and that is how come she packed and left. So we are talking about poor functioning in the family system, poor functioning in society, right? Your interpersonal relationship with other people have been impaired. Then occupational functioning, where you have a difficulty in contributing to wherever you have been assigned a job. And so this is very key. And you saw in the documentary that apparently he was relieved of his job. You understand?
Dr. Azu.
You know? So this is the impairments that we are talking about. Then the third criteria is that the person uses the substances despite risk to him or herself. And so you asked him a particular question, which I would want to highlight. That
Okay.
did you have any effect from the medication in terms of your physical? You understand?
Any health complications.
You understand? We have people who the doctor has told you that, hey, Mejafo, you have liver cirrhosis. Or to it, your liver is failing. But Mejafo, sorry, Obekoba. You know that this is what is happening, but you are still going to the bar. We have situations that you have gotten bankrupt to the extent that you cannot even pay your debts. But yet, when you get up, you go to a different bar and go and borrow to take one shot. You understand? You know that you are going to maybe drive from Accra to Kumasi as a driver. But because you are dependent on it, you still go ahead and take the shots, which would impair certain functioning. That's the third criteria in order for us to say that somebody is dependent on a substance. Then the last criteria is that, which we usually say, cluster it as the pharmacological criteria, where we are talking about 2 things in here. Take note. Tolerance to the use of the substance. So, you have been using a particular amount of the substance and you get your high. But this time around, when I use the same amount, I am no more getting that high again, Charlie. So I have to what? Top up. You have been using a particular medication to relieve you of the pain. But this time around, when I use it, I don't feel it anymore. So now I have to go to its big brother. And that's the tolerance we are talking about. Then the last thing is withdrawal, where without the substance, you experience certain negative feelings and emotions. You understand what I'm trying to say? So these are the things that we talk about for us to be able to say that yes, somebody is dependent on a substance. And we were talking about why is it that KD would get dependent and Apostle would not get dependent.
Exactly. Big question.
You understand? Because Apostle is an anointed man of God. You know, it varies and is individual dependent. It's individual dependent, and it may based on your genetics.
Okay.
Because for some people they may easily get malaria, yet other people may not easily get malaria. I liked what KSM said, that yes, when you take the substance, you do get results. And so it is not actually a misconception that when you take cannabis sativa, you will get high and you'll be able to perform on stage.
It is true.
Because chemically, the cannabis sativa will provoke and induce what my brother was talking about. Certain neurotransmitters that gives you high energy. Certain neurotransmitters that makes you feel a bit of a disinhibition. And so you are able to approach things that hitherto you could not approach. But with time, and that's the positive reinforcement bit of it. So you take it, you get this. You take it, you get this. But what they do not know is that there are minor, the more you use it, the more you are exposed to it, there is what we call neuroplasticity, which happens. So in your brain, certain chemicals begin to deplete. Certain neurons begin to change. And so with time, if you do not use it, you experience withdrawal symptoms. And the withdrawal symptoms then become negative emotional states.
Okay.
So you are not using the cannabis, you get anxious, you get irritable.
Wow.
You are not using the alcohol, you begin to experience tremors. You understand? And these withdrawal symptoms, they start slow, they go slow, and it takes a very slow time before they go away.
Wow.
And so this time around, you are no more using it because you want to get high, but you are now using it because you want to get away certain negative symptoms that you are experiencing. And that's when we talk about negative reinforcement. And so there is a whole stage of it. Who said cheer? So these are the things that we are talking about. Now, to conclude that, what can we do about this to get people out of it? What I would say is that it is not as easy as ABC. And if I do sit here and tell you that you need to do ABC in order for you to get out of it, then I would be lying. And Apostle will tell you, you need to be assessed.
So the individual can't assess.
You need to be assessed. So it's
by a professional.
Yes, by a professional. A professional needs to assess you to determine that this is where you are.
Okay.
To determine that in your dependence, you are having an intoxication problem, you are having a withdrawal problem. It is this particular substance that you are dependent on because you may not know. And that is why I would always say that we should not be afraid, we should not fear or be stigmatized by walking into any psychiatric facility to say
At
that.
At what time do I enter that place?
These were the things I was talking about, that you realize that you are using but you can stop using.
Okay.
You realize that it is impairing your functioning.
Okay.
You understand? These are the things. And even when you are in doubt, come to Chosen Rehab. They have doctors there.
Yeah.
You understand? They will tell you that, Charlie, my brother, this is what you need to do. It is not everything that sometimes you need to go to rehab. If you have to go to rehab, they'll tell you that, you need to come to rehab. You understand? If
Exactly.
you have to do a detoxification, they'll tell you you need to do a detoxification. If you have to do an OPD counseling, they will tell you that you need to do an OPD counseling.